Dr. Kwiatek.
Chris.
Saw from your chart that you're having some chest pain. Can you tell me a little bit about that?
Well, it's just kind of like this tightness and squeezing on the left side of my chest. And I've had it since yesterday, but it worsened this morning.
Okay. And what were you doing when it started yesterday?
Well, I was getting home from work.
What kind of work do you do?
I'm a semi-truck driver, so I load the trucks up and then drive throughout the country, obviously.
Okay, so you sit for long periods of time when you're... Do you have a history of any heart or lung problems? Is there any cough with it?
No.
Any shortness of breath with it?
Not really. It hurts more when I breathe, though.
It does make it worse when you take a deep breath? Have you taken anything for it? Okay. I'm going to ask you some questions about possible risk factors for heart problems. Do you have a family history of coronary artery disease, heart attacks, anything like that, in somebody under age 55?
No, just hypertension.
Okay. And you personally, do you have a history of high blood pressure? How about diabetes? How about cholesterol?
Not that I know of.
Okay, so this chest pain, he says located in the left side, is kind of tight feeling, worse when you take a deep breath. Does it radiate anywhere?
No, it just kind of stays right there.
Did you get anything when it first started, like nausea, break out in a sweat, or get short of breath at that time?
No.
Okay. Do you have any leg pain or swelling that you've noticed?
Not any more than usual.
So we just have a little bit of what? Pain or swelling?
Yeah, just a little bit of swelling, and then it's just sore from moving all the boxes and stuff.
All right. Have you been sick with anything recently? Have you had a fever, chills? You haven't had any belly pain, diarrhea, urinary symptoms, unusual rash, difficulty swallowing, change in your vision, anything like that?
No.
So everything else has been pretty normal. Okay. Anything else that I haven't asked that you think that I should know about? All right. Well, let's take a look at you here. Open your mouth for me real big. Take a look up. Turn your head. Okay. Go ahead and sit forward for me. Deep breaths. And that's over here. All right, go ahead and lie back. Any soreness there?
Just a little bit on that side.
So minimal chest wall tenderness in the left parasternal area. S4 gallop. Not sore under here in the belly at all?
No.
Radial pulses are symmetric. Trace pedal edema. Are you sore in the calves a little bit? Not really.
It's more like the knees and ankles and stuff.
Okay. Well, we're going to rule out a few things here. You don't really have a lot in the way of risk factors for heart, and it's been going on since yesterday, so scribe, I think we'll put in for a single EKG with a single troponin, but I want to rule out also some other things that could happen, like with sitting for a long time, pulmonary embolism. So we're going to get a few tests related to that. We'll get a D-dimer. So a CBC, a basic, troponin, D-dimer, those will be our blood tests. We've got the EKG. Want to get a PA and lateral chest x-ray. But also let's get an ultrasound of both of the legs to rule out any clots there. And let's also get a CAT scan of the chest with IV contrast PE protocol to rule out any issues there. Meanwhile, I'm going to give you Toradol 30 IV, and hopefully that'll help out with the pain while we're getting this done. Any questions?
No.
Okay. Well, Chris, I got everything back, so I brought my scribe in because we're going to do your discharge here while I'm talking to you. So first of all, the good news. The EKG was fine, and scribe, if you could put in just a normal EKG on him, you can get the times off of the EKG. There's no old one, but his rate was 76 on there, and everything else was normal. So that was fine, and your troponin, which is your heart enzyme, was fine, so no issue there. I was a little bit more concerned about a possible clot to the lung, like we had talked about, but because you sit all day and so on. But all of those tests came back fine as well. So I think this is probably from lifting stuff. It's probably more muscular pain there. Remember I talked to you, the nurse had told me about your smoking, and I came in and talked to you about that before. So I'm just going to have my scribe go ahead and put in the chart all of the smoking stuff, and we'll give you some information on how to quit smoking, like I had already spoken to you about. But for comfort right now, I want to send you home with a couple of prescriptions. So scribe, if you could put in for diagnosis in addition to the smoking stuff, I'll go ahead and put in chest wall pain and a prescription for naproxen, which is an anti-inflammatory for you. That'll be 500 milligrams twice a day for 10 days. And then in addition to that, I'm going to provide you with a muscle relaxant because I think a lot of this is sore muscles. So put in for Norflex, and that'll be 100 milligrams twice a day, also for 10 days. And then you don't have a physician, I saw. So we have what we call a transition clinic that you can go to for follow-up, and they'll help you get into a physician, but they'll follow you up initially. So scribe, if you could make follow-up for 3 days from now at the transition clinic, that would be awesome. And I think that pretty much covers anything unless you have any questions.
Can I drive on those medications?
You can drive on the naproxen, the anti-inflammatory. The other one, some people find makes them drowsy, so I don't advise it.
Okay.
Okay then, good luck to you.
Thank you.
You're welcome.